A new goal today set by President Biden when it comes to getting Americans vaccinated. To talk about that and the latest news on COVID-19, we are once again joined by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, great to see you. We appreciate your time. The president says he wants to have 160 million Americans fully vaccinated, wants to get at least one dose to 70% of adults by July 4th. Given the slowdown vaccination rates that we keep seeing, do you think that's even realistic, and what needs to be done to reach that 70% by July 4th?
Hi, Maria. I think President Biden is very realistic. He tends to overpromise in a sense, and he delivers on his promises, okay? And so when you think about it, just to put things into perspective, 148 million people have received one dose already, okay? So that's literally 61% of adults. We only have to get to 170 million to reach 70%. That's very likely over the next 2 months. If we keep vaccinating 1 million people a day in the United States, we will achieve that goal. That's not the challenging part. The tough part is actually getting above and beyond that 70% target, because that's really where vaccine hesitancy really kicks in at that point.
So let's expand on that. There's a lot of debate, Dr. Ellen, about herd immunity and the level of vaccines needed to reach that. So, you know, is it a moving target, or in your view, is there a number? And would 70% of Americans partially or fully vaccinated, would that be enough?
So first of all, Ed, no one knows the number, okay? But I want to explain it to you like this. When we talk about measles, the vaccine is outstanding and you don't generate variants. So herd immunity is real, and that's why we don't really see measles in the United States. And when we see a few cases, it tends to die out. It's been eradicated. Influenza, we don't talk about herd immunity. We have an average vaccine, a moderately effective vaccine, and we know that there are many variants. With COVID-19, it's probably going to be somewhere in between. We have an excellent vaccine, but we're generating lots of variants. So even if we can reach herd immunity, it may only be temporary, okay? But it is true. The more vaccine hesitant people we have in the U.S., the tougher it will be to achieve herd immunity, even though it still remains elusive.
None of us can speak for people, but what do you see as the Director of Infectious Diseases there as the biggest obstacle in getting people vaccinated? Are you surprised with where we're at right now? Just a short time ago, it felt like we were clamoring to get these appointments and working it and refreshing and trying to get it. And now you can't get enough people vaccinated right now. What's the problem?
So, Maria, there are lots of issues, but I'm going to take your question and I want to speak to two groups today. The first is young women who may be trying to get pregnant or thinking about starting a family maybe over the next few years, maybe next week. I want you to know that there is no evidence that the COVID-19 vaccine will impair your fertility. None at all. Over 1 billion doses have been given around the world. And if this were something that occurred, we likely would have seen it by now. So I ask you to speak to your gynecologist or your primary care provider to hear about that. The other group I want to talk to is blue-collared workers, okay? The people that really run the United States, the people, the laborists, the people that work their butts off to make sure that the United States functions. We know that as a group, you're essential workers, and currently you haven't been vaccinated in the numbers that we want to see. We want you to be protected. You're working so hard to help run the country. It's really important that you get vaccinated.
Dr. Ellerin, I know we're out of time, and this is unfair to ask you to do it in a short period of time, but I want to push this forward. Kids are the next horizon. Maybe even as young as 2 and certainly up to 16. Yes, no, this is the smart thing. This is not a smart thing. What's on the horizon for children?
This is a very smart thing. Very soon, the FDA is likely going to issue an emergency use authorization for the 12 to 15 group, knowing that their vaccine specifically is for 16 and older now. This is very important. While kids tend to do very well, they don't get severely ill, hospitalized, or tend to die. There are rare cases where young kids can die. We know about that multi-system inflammatory syndrome that can be very severe, but also we want to protect all of us, right? And they're part of the transmission cascade. Also, think about it as parents. We want our kids, we want to have the confidence that they can go out there and then they're not going to get infected. So yes, thumbs up to kids getting vaccinated, and so far in the phase 3 trials, and we have to look at this through a lens of safety. So far these vaccines seem very safe, and the kids generate a very good immune response, at least in the 12 and older. That's the data we have so far.
Dr. Todd Ellerin, we appreciate your time. Thank you,
Take care,
doctor.
guys.
Stay well.
Thanks.
Be well.